name's John. I'm going to be your student nurse today. Today we're going to be doing a wound dressing change. I'm going to need to expose you a little bit to get to the wound. Could you please verify your name and date of birth for me? Thank you. Next, I'm going to perform hand hygiene. Then I'm going to be putting on some clean gloves. Then I'm going to ask the patient, have you experienced any pain in the wound lately? No. Have you, what about when they perform wound dressing changes? Do you feel any pain then? No? Okay, good. Next, I'm going to lower the guardrail, or raise the bed to working height. And then next, I'm going to need to expose you. I'm going to try and do this. Quickly, so that so that you're comfortable. Okay. Next, I'm going to be taking off the wound dressing. So I'm going to start from this edge and do this edge, then towards the middle, and then I'm going to pull up from the middle, and then I'm going to discard this, but I have to use it for later because I don't have two of these. Next, I'm going to pinch from the center of the gauze and discard this one. Center of the gauze and discard. And then I'm going to take off my gloves, perform hand hygiene, put on new gloves. Then I'm going to open the dressing change tray, take out the sterile field, and being careful to only touch one side of it. Going to let it fall, and then place it far to near so that I don't reach across the sterile field. And then I am going to dump the contents of the sterile kit onto the tray, and I have to reuse this bandage because I don't have two, and I took it off in the beginning, so I just put that in there. And then dump from 6 inches above. Set that there. And then if I were going to use gauze, I would put the gauze into the tray and then pour sterile saline onto it, and then use the gauze to clean from top to bottom, clean to dirty. But I'm just going to use the swabs instead. So next I'm going to pick up the swabs, touching only the swabs. One of them fell out. Pick it up, touching only the swabs. Then I'm going to open the package on the side that says open, and then touching only the base of the swab, I'm going to clean from top to bottom, clean to dirty. discard the swab, clean from top to bottom, clean to dirty, discard, clean from top to bottom, clean to dirty, discard the whole pack, the empty package. Then I'm going to take off my gloves, perform hand hygiene, put on new gloves. Then I'm going to assess the wound. It's approximately 5 centimeters in length. There are 6 sutures. The ends are approximated. The perioperative skin is in good condition. The skin around the wound is in good condition. It appears to be healing. The patient reports that there's no pain. It's a midline abdominal wound. And then next, I'm going to be putting on the new dressing, starting with the gauze, pinching in the middle, placing it down. Second piece, pinching in the middle, placing it down. And then lastly, this the bigger bandage, pinching in the middle, placing that down, then adjusting, touching only the top side. Then I'm going to tape the wound, all four sides, and then I'm going to discard the sterile field. Discard the tray, the sterile saline. Alright, next I'm going to take off my gloves, perform hand hygiene, cover the patient back up. Did you have any pain, or did you feel any discomfort? No, you didn't? Okay. And then next I'm going to raise or lower the bed, and then raise the guardrail. And then I'm going to remove my gloves. Discard them, perform hand hygiene, and then for documentation, I'm going to document that it was a midline abdominal wound. There were 6 sutures. The edges were approximated. It was approximately 5 centimeters in length. The patient tolerated the procedure. Reported mild pain. I'm going to reassess that within the hour. The skin around the area showed no sign of infection. The perioperative skin looks good. And then I'm going to make sure that the call button is near the patient before leaving, and the provider will be with the patient shortly.